Welcome. Thank you for joining us for our latest Public Health Conversation Starter. I'm Sandro Galea. This is a series of conversations we are having with thinkers who provide a critical perspective on the work we do in public health. Today, I have the privilege of being joined by Dr. Lee Vinsel. Dr. Vinsel is a professor in the Department of Science, Technology, and Society at Virginia Tech. He studies human life with technology with special focus on the intersection of government, business, and technological change. Since 2015, he has worked with collaborator Andrew Russell to organize and lead the Maintainers, a global interdisciplinary research network that examines maintenance, repair, and the mundane work of technology. His latest book, co-written with Dr. Russell, is The Innovation Delusion: How Our Obsession with the New Has Disrupted the Work That Matters Most. I'm really delighted to have Dr. Vinsel joining us today. Dr. Vinsel, thank you for being here.
Thanks so much for having me.
I'm very interested in asking you some questions about your book, but before we go there, let's start from basics. Can you just tell us a little bit about you, your background, how you ended up to sort of becoming a scholar dealing with technology?
Yeah, my PhD's in history. I'm a historian of technology by training. And then after I landed my first job at Stevens Institute of Technology, before I came to Virginia Tech, I started broadening out from history and paying attention to what a lot of other fields in the humanities and social sciences were saying about technology and human life with technology. So I have a podcast called Peoples and Things, where I try to, broadly see how social sciences are dealing with technology. Yeah.
All right. Well, let's delve into that. And we reached out to you in part because of sort of this hype, perhaps mania about AI, and you've written about it. You wrote this recent essay, which I really liked, in the Chronicle of Higher Education, and you suggested that the AI hype may echo past bubbles of enthusiasm about technologies, which eventually popped. So I guess I have two questions about that. Number one is, can you comment about AI specifically and why you think that may be the case? And then maybe you can comment on how AI is a particular example of the more general case. I'm just curious about your reflections on the more general case.
Yeah. Well, it's kind of the ChatGPT moment is kind of amazing because we just had a AI hype bubble around 2014, 2015. There were a lot of books like The Second Machine Age and The Rise of Robots, and a lot of op-eds coming out that were about how, AI was going to take away jobs and lead to like 40% of people becoming redundant. And that didn't happen for the most part. We can show with numbers. And, that one is just like the last in a line of bubbles that have been around AI. There was a bubble in the 80s. There was probably a bubble in the 60s. So this is a kind of recurrent thing that happens with AI technology. And, I think it usually happens when something new happens with AI. So right now it's ChatGPT and generative AI, like image generating AI. In 2014 and 2015, it was like, robot or computers beating us at chess and games like Go. So there's usually something happens that gets people excited, and then you have another moment. And there's a great book by David Kirsch and Brent Goldfarb, Bubbles and Crashes, that looks at the more general issue of when we see bubbles around new technologies. We don't always, but very often it's a kind of common thing to see, where, especially when it's a consumer-facing technology and a technology that's easy to invest in, a lot of energy gets driven around it, and so we see bubbles.
Yeah. So, it reminds me a bit of something about which I've written, around which I've engaged, which is precision medicine, which became, which really took over for about sort of 7-8 years ago, has become, the thing that's going to solve everything, all health problems. And, I wrote quite a bit about this, and, I never had any concern with precision medicine itself. But my concern was largely with precision medicine as the solution to everything. Now, this is something that you address, not precision medicine, but this notion in your book, Innovation Delusion, which I really quite like. Is there a fix to that? How do we keep ourselves level, perhaps more careful, to make sure that the shiny new doesn't make us disinvest from the important hard work of incremental progress?
Yeah, I think it's really hard in our culture for a variety of reasons. We've become a very technologically fixated culture in the post-World War II period. There's even trends that go earlier than that. So there's a lot of things around us in our society. If we go along with them, we'll end up following the shiny and new, you know, whether it's media and advertising and things we're seeing on that front, or just hearing exciting stories from our friends, you know, they're reading stories in the New York Times or whatever. And so we're getting it. So it's very easy to go along with. I do think that we can create habits of, you know, just skepticism, organized skepticism, of saying like, okay, here's this new thing. We've done this before, though. This has happened several times in my life. And so we'll see what happens in the next 2 years with this tool like ChatGPT, for instance. And, you know, and it really, what we're talking about the innovation delusion is how, yes, we have this fixation on innovation, but one of the problems is that it leads us to neglect just those everyday things that we got to take care of. And ultimately, it sometimes leads us to lose track of our mission, right? And so that's part of what we're trying to say in the innovation delusion is like, just remember really what you're trying to accomplish. Tools are helpful, and, you know, maybe they will help you get towards your end faster or more efficient. But like, if you become too focused on the tools, you can lose sight of all kinds of things.
What's your definition of progress? Is it primarily social, moral, technological? And is progress inevitable?
Well, I mean, this is something we tackle in the innovation delusion, because when you see the use of the word, you can use tools, Google Ngram, to look at word usage over time. When you see use of the word innovation going up in the 60s and 70s, it's exactly the same moment that use of the word progress is going down. So people are using the word progress less and less, using the word innovation more and more. And we say it's kind of become a substitute term. But innovation really lacks that progress. I think in that old sense really was always included moral progress. It wasn't just the technologies improving. It was like societies and our moral life supposed to be improving too. And so, you know, I think we have to keep those two things separate. We can have technological progress, like, you know, the opioid addiction was in some ways a kind of technological innovation, medical innovation, marketing innovation, but it's very destructive, right? It's not moral progress in any sense. So I think we have to keep these two things separate and recognize, I think I'm not a Luddite. You know, I want to make that clear. I'm not anti-technology. So I recognize technological progress, and I think it has benefits, right? But I think then we also have to focus on, you know, what we're trying to achieve morally and together as a people.
Let me read you a sentence you wrote, which I really like. You wrote, "I grew up in the Rust Belt town of Joliet, Illinois. Growing up around abandoned steel mills and industrial decline gives one a certain sense of life with technology." I really like that sentence. You know, what that evokes for me is, of course, sort of technology leaving behind a population. I really like the echoes you just made. Can you talk a little bit about, you know, how we do embrace technology? I like you, actually, I also like shiny objects.
Yeah.
You know, how do we incorporate technologies that have potential and not lose our soul? How do we incorporate technology and not lose a moral compass that progress has to bring people along? And of course, I'm asking this from an interest in our society, but now putting on my population health lens, because of course we care about making sure that we do not create people who are left behind and health left behind.
Yeah, well, I mean, I think that, you know, you're putting your finger on the thing. By the way, I now live in Appalachia. So, I mean, I went from the Rust Belt to Appalachia, and you know, these kind of like crusty, rusting places are, you know, close to my heart. Yeah, I mean, I think this is the thing. And if we look at public health, for instance, we can think of like infant and maternal mortality amongst Black women, for instance, or we can think of how, because people don't have access to septic tanks in lots of rural places, we have the reemergence of tropical diseases, especially amongst like poor Black populations. These are not things that we need shining. Technology might help us achieve these ends, right? I mean, we can deploy technology to do those things, but we really, even on a public health level, have to attack those things very directly and say, you know, as a society, we're going to morally address these issues because they're important, right? And I think that this is the thing. I think that we get too fixated on, traditionally, you get too fixated on technological, what's sometimes called solutionism, thinking that if we just keep improving technology, these situations are going to go away. But I think in a lot of cases, we really have to address them in a much more direct fashion.
Let me go, I've been asking you questions about your most recent book, but I want to go back to your previous book, which was Moving Violations, Automobiles, Experts, and Regulations in the United States. Now, in public health, we often use motor vehicle safety as a paradigmatic example of regulation shaping context. It was something that, it is one of the biggest successes of public health in 100 years that injuries due to automobiles plummeted as much as they did, by about 200-fold. There really is no comparable success like that. And of course, it comes down to regulation. And we use public health as an illustration of the balance between regulation but respect for autonomy. We still have cars. One might argue from a climate point of view that that's to our detriment, but leaving that aside for a second. Yeah. But we created seat belts and airbags and roads and safer roads and shatterproof glass, which made cars much safer. So you use that metaphor because you've written a whole book about it. I was wondering what your thoughts are about that metaphor applied then to technology in general and AI in particular.
Yeah, well, I mean, part of the reason I wrote that book is because I do think we can use the kinds of standards that we've used to regulate automobile safety, but not just safety, emissions control and fuel use too, to handle all kinds of issues. Okay. And the easiest one to talk about is actually more like climate change. We can use standards of various sorts to, for instance, reduce greenhouse gases. It's very clear how we could do that. And I think that we should, because kind of contrary to one view out there in our culture, these kinds of government regulations, they don't impede innovation. They actually drive innovation in the ways we want to see them go. The way we want to see technology go for the public good, including a public health benefit. So that's the argument I make, is that we can use regulations to drive innovation in the directions we want to. Now, I think AI is interesting right now because if, I follow these debates pretty closely. I know lots of AI regulation and ethics experts. And what we want to ask ourselves is, how are we going to use, let me put it a different way. How are we going to define the standards in an appropriate technical fashion to control AI in the way we want to? And I think very often we don't have good answers on that front yet. And important because we just aren't clear enough about what the AI could do, what we want it to do, what we don't want it to do. And so I think there's a lot of technical work on the standards front to be done yet before we can really say, oh, we have a clear framework or paradigm for regulating AI in the way we've regulated auto safety, for instance.
Thank you. I actually appreciate that. I think there have been very few people who've actually been saying what you just said, which is actually there's a lot we don't know before these standards can come into place. Let me shift a little bit from AI to go back to another example around technology, and I'll talk about COVID for a second. As someone who's outside of public health, looking into our whole global response to COVID, I'm just curious in your reflections on the role of technology there, because of course, COVID hit and you saw, like I did, the thousands of different stories and the thousands of different apps, all of which were going to be the solution to COVID. And in my assessment, none of them actually were anything like that. Yeah. And I'm curious how you see that from your perch as someone whose technology is your area of scholarly interest, but not health per se, and how you navigate that moment intersecting with technology.
Yeah, I mean, three brief things come to mind. I mean, the first thing, the apps that you're talking about, that really was an amazing moment. It was like we were going to have these tracking apps and they were going to do all these things. And that turned out to be pretty silly in a lot of ways, right? I mean, it just didn't deliver. I do think we should emphasize just how amazing it is, how quickly we turned around vaccines, right? I mean, that is truly amazing. And I don't want to downplay that, right? It's like, again, people sometimes think I'm a Luddite, and we put a lot of money and effort. We could have put a lot more money and effort into it, frankly, I think, but that was a big success story. The other thing I think in terms of regulation, and this also connects back to automobile regulation, is how eventually the, parts of the public started resisting controls of various sites, mask mandates and all these kinds of things, right? And we also see this with automobile regulation. We're good at putting airbags in cars or regulating. We have been good at times at regulating the auto industry and changing the technology. What we don't do very often is really do behavioral controls to get people to stop speeding. For instance, we don't use cameras everywhere to capture speeding and give tickets out as much as we want to. And that's because the American people tend to bridle when those kinds of controls come into play. So we're very much less comfortable in kind of regulating ourselves, even though I think practices like that end up being really important.
What do you think are the key, let's call it dispositional habits that one needs to adopt to be able to simultaneously inhabit an enthusiasm for the future and for the potential of new and better, but coupled with sufficient skepticism not to get distracted from the fundamental work that needs to be done to get us to the future?
Yeah, I think it really is two things. I mean, I really do think we need to teach organized skepticism around new technologies in school, frankly. I think that new technologies are always going to be rolling at us, and they're always surrounded by hype, because that's just the nature of business. That's the nature of how new industries work. And people just get excited around new technologies. So that's the nature of and also media plays a really important role. That's the nature of the thing. And just like, we sometimes teach like media literacy, I think we need to be teaching people like, hey, let's look at all these other examples going back 150 years of all the, really extreme things, both positive and negative, by the way, because hype can be criti-hype is what I call it, negative hype, about how terrible it's going to be. We have all these examples of positive and negative hype. Maybe we should learn from that and like just be a little, tone it down and realize that, we live in a bad information environment around new technologies. And then I think, a lot of it's around wisdom. Wisdom's hard to teach, I think, because wisdom is what, leads us to not just be skeptical, but then remember, well, I got a job to take care of. I need to keep my eyes on what really matters here, whether it's budgets and activities and all these things. And then we can think about how are new technologies going to come into this process and maybe improve it. We know they do that. But really it matters about what we're trying to get done. So those are like the two habits. I think it's about like organized skepticism around what we're hearing around new technologies, and then just wisdom, which, there's a debate going all the way back to Socrates about whether you can really teach that or it's some other kind of thing.
Well, that sets up my last question very well. Let's talk about advice for students. So what advice do you have for somebody who's earlier in their life trajectory, embarking on, let's say, graduate school, and who's interested in technology, its role in shaping health? What advice do you have for them in terms of their learning and how they incorporate that into their practice?
Yeah, I mean, like, so for instance, we can take, I just saw, like, literally 20 minutes before I hopped on the call with you, I got a note that someone's going to teach a workshop here about using AI or using ChatGPT as a tool and not seeing it as a threat in the classroom, and how we can do that. And I think, around ChatGPT, for instance, I tell students like, hey, if you want to play with this thing and see what you can do with it and how it works into various flows, as long as you're not cheating with it or like using it in a way that would count as plagiarism, I think that's great. Like, go ahead and do it. And I think that's true of a lot of new technologies that come along. It's great for people to get experience, but also, they need to learn, have realistic expectations around these things, and having realistic expectations about what they can achieve will also be better for them on the job market and when they enter businesses and jobs all around the place, to assess new technologies and think about how to implement them in their work.
Professor Vinsel, thank you for joining us, and thank you for everything you've been writing and doing. I've really enjoyed your balance of let's say optimism, investment in thinking about these technologies, but also with a healthy dose of skepticism. Thank you.
Thanks so much for having me.